Good morning, guys, and welcome to Unique Not Different with me, Shamla. And today I discuss first aid mental health training with members of the Inclusive Hope. I have Mira, who is the Chief Inclusion Officer, and I have the lead trainer, whose name is Christine Cox. And on November 28th, they have a webinar, and in December 18th is the start of the mental health training. And good morning, guys, and welcome. Hi, Mira. How are you doing?
Good morning, Shamla. Thank you for having us.
Awesome. It's a pleasure. So, can you tell us who is Inclusive Hope and Art Assistive Learning Technologies?
Well, Advanced Learning Technologies is a limited liability company based in Trinidad and Tobago. We operate as a social enterprise with a commitment to empowering persons with disabilities and vulnerable persons in our communities. Under the brand Inclusive Hope, we champion diversity, equity, and inclusion, creating supportive environments for these individuals across various spheres of life, be it at home, be it at work, or during leisure activities. You can read more about this at the website, www.inclusivehope.com.
Awesome. And what was the main idea behind this mental health first aid training?
Well, mental health first aid training seeks to educate individuals on how to provide initial help and support to someone who is experiencing a mental health crisis or challenge. It guides them on how to start the conversation and offer reassurance. Given our present society, it's very relevant because of the challenges caused by COVID-19. You know, the increased bullying and violence in schools, currently the increased unemployment, poverty, substance abuse, rise of suicides, domestic violence, and so on, including child abuse as well.
Awesome. And what is the main goal behind this training?
So our mental health first aid training provides vital education on addressing a spectrum of mental health challenges. It equips the participants with the skills to offer immediate support until professional services are engaged. We do believe that organizations such as the police, the first responders, police, nurses, EMTs, educators, counselors, caregivers, priests, customer service representatives can all benefit from the program. We are currently approaching various ministries, NGOs, and multinational organizations to partner with us to launch this program throughout Trinidad and Tobago and eventually extend our reach throughout the region. Additionally, we are also committed to empowering persons with disabilities and vulnerable persons by training them to become mental health first aid instructors, therefore broadening the program and its accessibility and its impact.
Awesome. And welcome, Christine. And you're from Thailand, so I hope everything is good at first day on your end.
Thank you for having us on your show. Yes, it's
Can you tell us about so can you tell us about the structure and content of this program?
Okay, so the criteria is that there are no qualifications required. Okay, so anybody can do the program. Program is modular based, focusing on understanding and responding to mental health issues. The qualification is assessed through both a practical demonstration of first aid for mental health action plan, as well as a multiple choice questionnaire. The training is available in various formats, such as online, face-to-face, in class, and can be tailored for specific groups, such as workplace environments, educational facilities, healthcare organisations, as well as other communities. The program has a basic awareness module, a youth mental health module, as well as a module for adult health as well. So that's our training.
Awesome. And in terms of so it's a week-long program, what I read, right? And can you tell us a little breakdown of the modules?
Well, the modules include learning how to recognize when a person is in crisis or is struggling with their mental health. And our certified professionals from Advanced Learning Training will conduct the training with participants receiving a United Kingdom certification upon completion of the course. Learners are presented with a Level 2 award in first aid for mental health awarded from the Office of Qualification and Examination Regulation, which is called Ofqual in the UK. So it's just being able to recognise anybody who is struggling with their mental health, offering guidance, listening non-judgmentally, providing support, and then encouraging them to seek assistance from the relevant professionals who are able to assist them in their times of crisis.
Awesome. And is this a one-off program?
Oh, no, definitely not. We are starting our training program in December, starting from December the 4th through to the 22nd of December. And they will be, run throughout the weeks and the months. We are looking also for towards next year. So to register, anybody can visit our website at www.inclusivehope.com or send an email to info@inclusivehope.com. These programs can be tailored to organisational requirements as well as for individuals who just wish to take up mental health training as well. So similar to the Red Cross first aid, it is recommended that a person attends a refresher course every 3 years just to keep on top of their training.
So, and Mira, how do we know that, this will reach the right persons?
Well, through targeted outreach, partnerships, community engagement, we aim to, reach key groups in our community. Currently, we do have a booth at the Diwali Nagar, and we invite all persons to attend. We have the website. We do have social media presence on LinkedIn. We have YouTube channels trying to educate persons. On all social sites, our handle is Inclusive Hope. And we do invite organizations like Employers Consultative Association, HR MAC-TT, UE, University of the Southern Caribbean, UTT, the Ministry of Health, Ministry of National Security, especially for our police service and our prison service, the Ministry of Social Development, Ministry of Sports and Youth, to partner with us as we roll out mental health first aid. This is a national issue, and we believe our programs can help and assist save lives, reduce crime and violence in society.
Awesome. And Mira, I know you do a lot of voluntary work through Inclusive Hope. Can you tell us a bit, about personally what you're very passionate, because I know you personally, right? Very, very passionate. Why, volunteer your time, effort, and energy into persons with disability, mental health, and so on?
Yes, we do know each other over the decades, and that's something I think I've always been high in empathy. The space that I come from, my background is special education. And the thing that triggered me was that my students, they don't really have anything to do after they finish. They go through the system and there are no opportunities, or there are limited opportunities for them when they're finished. So in this way, I decided, okay, I would like to do something more. I mean, given our current tech age that we live in, there's so many things, so many opportunities, so many ways, and COVID-19 raised that. Lots of things can be done online. So that's where the idea of inclusion, Inclusive Hope comes about, because hope, we need hope to survive. We need hope for tomorrow. We need something better to look forward to. And then given present day society where inclusion is concerned, inclusion is not about one aspect, it's about all of us despite our backgrounds, despite where we come from, what we've been through, how, but the thing is, access doesn't always equal accessibility. So that is where Inclusive Hope comes in. And we decided to create those opportunities and try to sustain them. And this is where, this is at the heart of it all. It's people-centered.
Awesome. And Christine, same goes to you. Well, you've been part of this program. What value do you see in this initiative and volunteering your time?
I just want people to be able to embrace or encourage people who are struggling in their lives to seek help. It's tragic for me, the number of young people who, unfortunately, due to traumas that they've suffered, cannot cope with life, and even having depression. Depression is just sadness and not being able to find a way out of it. And that breaks my heart to see so many young people and so many other people suffering when there can be so much help that's given to them. So this is why I got on board with Mira and Inclusive Hope.
And also, Mira, can you just reiterate how persons can register?
Persons can go to our website, visit our website, and register for the mental health program. They can send an email to info@inclusivehope.com. They can reach out to us by checking us out on social media. And we're happy to hear from anyone who is interested, anyone who wants to partner with us, allies in the space where we always welcome. We're always about collaboration.
Guys, I want to say thank you so much for doing this initiative. And I'm sure persons will be impacted. And I really hope they see the value and register. So that being said, I want to say thank everyone for tuning into this week's segment of Unique Not Different. As I always say, until next week, be good, do good. Bye, everyone.
Thank you. Bye-bye.